Let's continue to stay safe and stay at home. Together, we can beat this.
Well, it's a very good day to you and welcome to our special program, and it's brought to you courtesy of Government Communication and Information System, the GCIS, together with the Department of Health. My name is Kara Bolans and I'm pretty excited to have you with us today. We're going to be discussing issues that are arising from the Department of Health, which they have to do with COVID-19 and where we are now as a country. And I'm pretty excited to be welcoming the Deputy Minister coming from the Department of Health. And this is Deputy Minister Dr. Phaahla. And it's a very good day to you, DM. Thank you so much for having made time to come and spend some time with us here.
Well, thank you very much for having me here.
Right. Just before we jump into the matters of today, I'd just like to inform you that you will notice that we've lowered our masks. And that's because we would like to cater for those who have difficulty in hearing so that they can be assisted by reading our lips. So in that instance, we've lowered our masks, but it does not mean that we don't put them on. Immediately after this engagement, we'll definitely put them on. So please bear with us and seeing on that regard. Well, DM, let's kick off. There's so many things that I would like us to discuss for this morning. And perhaps let's start here, DM, the achievements that the Department of Health can share with the public during the lockdown. Maybe let's start with that one.
We are very grateful for the decision of Cabinet to have, adopted the lockdown because it has really helped us, one, in terms of flattening the curve, basically keeping the numbers of people infected with the coronavirus down. Because of the fact that during the hard lockdown especially, we have made gains. It limited movement. That made it possible that we have the kind of numbers of infections which we have. Obviously, we would have wished to even have lower. But if it wasn't for the lockdown, this would not have been achieved. We laid the foundation, one, in terms of preparing the health services. In the absence of movement, there were very few, normal pressures on our health services, like car accidents, also injuries from assaults. So our health facilities had some breathing space to prepare, make sure that in many existing facilities, some of the facilities can be reorganized to be ready for the COVID-19 flow-in of patients, but also in terms of adding additional facilities for isolation and quarantine beds, field hospitals, especially in your big areas where there is going to be a lot of pressure.
DM, you've touched a little bit on the preparation of the healthcare system during the lockdown. And, I've been looking around and reading around and listening to the news as well, and big figures are being mentioned. I mean, we're talking about 600,000 people getting tested. We're talking about 18,000 tests that are to be done on a daily basis currently. Just take us through some of those preparations and more.
Well, indeed, when the first patient was detected on the 5th of March this year, the tests were done largely in the private laboratories, and also with the NICD, very limited capacity. And then, of course, we built the capacity from the NICD. We added the National Health Laboratory Services. They could do just a few tests in the beginning, about 500, 1,000. And now we've reached a stage where in the last 7 days or so, there has not been a day when we have done less than 15, 16,000. And in the last 3 days, we've gone up to 17 and also up to 18,000. We're still hoping that we can increase that capacity even up to 30,000 or more. In terms of screening, we have passed 10 million of people who have been screened of symptoms during this period.
One interesting thing is the partnership that we have with the Cuba doctors and experts. Just to bring us up to speed with regards to that.
Well, again, we're very grateful for the internationalism of the Cuban people. So we are very pleased that they are here sharing experiences, because Cuba, one, has that experience of, helping in countries which have health challenges, epidemics such as Ebola and so on. So they have that experience. Secondly, this disease, COVID-19, our success of overcoming it, if one was to say 100 out of 100, 10% of it will be medical in terms of hospitals and treatment of people in hospital. That's 10% of overcoming COVID. 90% is community mobilization, organization, screening, preparedness, detection, and changing lifestyle. Now, so on that front, the Cubans are very, very strong because their normal day-to-day health services is anchored on community service, on community mobilization. So we're going to benefit quite a lot with their expertise.
I think come the 1st of June, if I'm not mistaken, we'll see for the first time after almost 2 months, the grade 7s and the grade 12s will return back to school. And they'll be living under what we call the new normal. And I wonder how prepared are we, DM, in terms of going back to school and keeping the school safe, perhaps. Let's talk about that.
There are a lot of views about the correctness and the wrongness, if there's something to be called that, of actually taking the children back to school. To me, before we go into the technicalities, I move from the premise that we don't have a vaccine for this virus. As we know, it's a virus which has been with us for about 6 months. As long as we don't have prevention in terms of a vaccine, it's going to be with us for months, and it might even be years. And therefore, things which we can do without, those which causes infection to multiply and we can do without, those things we must just discard. The things which we can't do without, we must find ways to do differently. And one of those is education. You can't say because there is coronavirus, the generation of our young people of today must lose out. Because if you're waiting for the virus to disappear, we don't know when, if ever. So it's proper that, because education is vital, is central, then it is important to find ways to say, how do you get back into it? Make sure the children still get education, but with precautions. Now, some of those precautions, as we know, key to the spread of this is congestion, where people are congested. So, as you would have seen from the announcements of the Minister of Basic Education, starting small with only 2 classes: one, the end class in primary, and the end class in secondary, grade 7 and grade 12, because they have to migrate into different levels of education. So it's very key. So, but that also keeps the numbers down. Make sure that protocols are observed, temperature checks, sanitation at the gates, at the entrances, keep a distance, as no congregation as they enter the school. Inside the classroom, make sure that they are a meter at least, or a meter and a half distant. Actually be informed. If you wake up in the morning, you have a cough or a sneeze, don't come until it's over. You know, so all those precautions are going to help us, because we assume that until there is a vaccine, this is going to be with us. So going forward, schools are going to be run that way.
Right.
Yes.
All right. The 24th of May 2020, President Cyril Ramaphosa takes on the podium, and he mentions that come the 1st of June, we'll be getting into the other level of the lockdown, which is level 3, which brings about a number of changes. And one of those is the opening of the selling of liquor, which a lot of people were excited about. But here's one thing that he's also mentioned, is that the cigarettes are not going to be sold at this stage of the lockdown. The risk factors that comes with the smoking of cigarettes, DM.
Well, it's undisputed the fact that amongst very key risks if you get attacked by the COVID-19 virus, it's when your lungs are already compromised. If you had to look at what hits on the lungs directly, there is nothing more direct in terms of damaging the lungs than the smoke, cigarette. I mean, nicotine, the tar, all those things, they damage the lungs. They lead to chronic obstructive airway disease, bronchitis, even when you get the reports from the areas which have been hard hit with huge mortality, you find that amongst the highest is people who have been smoking. I mean, one knows that because this is a long established social behavior of smoking. It comes for ages ago. But the fact of the matter is that that is the thing. So it is a small contribution by the state to try and encourage people who are smoking, to keep away from it, so that they can have a better possibility that if they get the virus, then the complications which lead to ICU may not happen.
Dear, I think finally, as we wage war on COVID-19, and we have been doing for quite a bit, what do we do in workplaces?
Things which we can't do without. We have to know how to do them differently. And one of those is earning a living, building the economy, making sure people have income, they can feed themselves, feed their families. The economy can grow, we can produce goods. The question is, in the midst of this, how do we do them differently? I mean, first of all, one can mention right from leaving home, got to make sure that you wear a cloth face mask, protect yourself. In the transportation, if you're using public transport, make sure that it's properly sanitized, that that transport observes the requirements of social distancing inside. When you arrive at work as well, all employer work stations, basic stuff again, have to make sure that the workforce is tested for temperature at least on entrance. Make sure that everybody arrives with their mouth and nose covered. Make sure that there is a proper hand sanitation. Make sure that the workplace also, as much as it's possible, where people are working, that there is a distance of at least 1 to 1.5 meters. If it's not possible, create some kind of barrier, some kind of shield to protect the people who are working. Those are the things which are going to have to be routine. Those who are over 60 with comorbidities, complications like heart disease, lung disease, like asthma, diabetes, and so on, and those kind of risk factors, wherever possible, employers must assist them to work from home. Because the option is to say, people shouldn't come, but then they must earn an income. So largely would encourage that wherever it's possible must be work from home. Avoid the normal things which usually we do, gathering during tea breaks, sharing scarf tins, those kind of things are things of the past, unfortunately. It's very social during tea break or lunch to put together, share some, this one brings some bit of fish, chicken. We're done with that. Everyone keeps their scarf tin.
Yeah, true.
Everyone. And then, of course, the workshops and all those things. Right. I mean, we need to find ways. We need to do them remotely now in terms of using the modern technology. Right. Yeah. So those are the new norms which we're going to have to live with.
So there we have it. That's the Deputy Minister coming from the Department of Health. That's Deputy Minister Dr. Joe Phaahla with us. DM, thank you so much for your time, and thank you for bringing us up to speed with regards to what the department is doing, and hopefully we'll see you again next time.
Thank you very much.
All right, so there we have it. And that's how we come to the end of our discussion with the Deputy Minister coming from the Department of Health. If you want more details with regards to what government is doing, you can go onto the GCIS website. It's www.gcis.gov.za. That's gcis.gov.za, and there you can find more information with regards to what's happening. So from myself, Karabolans, that's it for now. It's in our hands. Keep safe and ciao for now.